Dr. James Castillo. I've been fortunate not to have to go through the process of having a lawsuit, but I have seen colleagues have to go through it, and they go through a lot of emotional distress. I've seen the stress it puts on them and their families and their practices. And usually it's for nothing that amounted to negligence. And I don't think lawsuits or the process of having a lawsuit does anything to change the quality of care that's practiced. If anything, it encourages defensive medicine. And defensive medicine is not high quality medicine. It's not good medicine. It's medicine geared towards the courtroom and what makes sense or what'll look good in the courtroom, and not really what's best for the patient. I know of some specialists who basically have to work for 3 or 4 months just to pay their overhead on malpractice. And after that, they can start paying for their staff and their rent and their other expenditures. And after the time they're done, they might be working for themselves for about 2 or 3 months. And that cost is paid for by everybody. Nothing's free. And the system will always factor in that type of cost into everybody's prices. And so we all end up paying for that. One of the reasons I chose to stay here was how much the environment changed after tort reform was passed. Tort reform was passed when I was a resident. And I saw the difference it made in a number of filings of lawsuits, most of which were frivolous. And those frivolous lawsuits not making it through as often to the courts anymore played a major role in my choosing to stay on here. I love serving this community. And to be able to stay here and practice without fear of being dragged into a hostile courtroom, it was one of the main factors that led me to stay. And it's actually helped keep me in the Valley. If tort reform was rolled back, I would see no benefit in that. Right now, Texas has enjoyed a tremendous influx of physicians because of the tort reform. And I think we'll lose that, and we'll probably lose ground and go backwards, especially areas like the Valley that have a history in it and that are still dramatically underserved, that physicians will find less reason to stay.